Hi everyone, Dr. Ernie from Posture Size. Today we've got some great personal training tips for those of you who have clients with lower back disc problems. We're going to be going over the assessment and correction of multifidus functions to help you keep your clients injury-free from lower back pain. So many clients with disc problems and lower back pain, including disc degeneration, herniations, and bulges, have acquired a weak stabilizing muscle in the lower back known as the multifidus. And if you don't know how to assess this key muscle and its stabilizing function in the lower back, it could cost you that client. If they get hurt during your training, you lose that client. You also miss out on the referrals if you do know how to do a good lower back assessment and know how to plug in corrections for weak multifidus muscles. That client's going to talk about you to other people, increasing your business as a personal trainer. So the multifidus muscle is a small muscle that runs off the bony knobs in the center of the lower back. Those are called your spinous processes. If you take your fingers on your own bony knobs and go to the lower outer corners, both the right and left corners, normally that muscle should feel that it has some substance to it. If you notice one side is depressed or it feels like a valley, that indicates atrophy. And if you engage the multifidus along with your other core muscles, such as your transverse abdominis, by pulling your lower abdomen in or asking the client to pull the lower abdomen in, that's underneath their belly button, pulling it in towards the spine, normally you should feel a bulging out against those outer bony knobs on the lower outer aspects, right and left sides. If you feel that it doesn't bulge out on one side more than another, that indicates a weak multifidus. The multifidus is an extensor, meaning it checks or holds the vertebra so it doesn't slip forward. Disc problems are classically aggravated with flexion or forward bending on the spine. So that weak multifidus causes an inherent weakness with that client when they're doing forward motions, such as squatting, such as during bent over rows, such as down dogs, such as doing high intensity interval work on their hands and knees. That flexion component is much more likely to aggravate that disc through compression of flexion. So if you have a client that has a weak multifidus, you notice one side doesn't bulge as much than the other, or if there's atrophy, if you feel a valley compared to the other side where there's not as much muscle tissue, there are many ways to engage multifidus, and we're going to focus on that in other videos on the channel. But for today, the most simplest way is to ask the client to bring their lower abdomens in and focus that pressure of lower abdomen pulling into the area that you feel atrophy or weakness. So if you notice that you go down those bones, those knobs, there's 5 of them in the lower back under the rib cage, and you can check from one level to the next. If you notice one side has a hollowness or weakness, ask the client to pull that lower abdomen in and focus that pressure into your thumb. You can put a little wiggle or a little tapping against the side of that bone to help stimulate the local nerves to help wake up that multifidus as well. And as with training, practice is key. You're going to, over time, have that client engage that multifidus more and more. Sometimes it begins as a very weak contraction, and then with practice, you'll get a stronger contraction and hopefully a nice level contraction from right to left sides that they can put into their training to help prevent lower back disc aggravation. If you like this video on lower back pain prevention for your clients, feel free to subscribe to our channel. We've got a lot of great videos out there on preventing and assessing lower back function, as well as other injuries for your clients. If you like this video and would like to help me share this valuable information with others, feel free to give me a thumbs up. Questions or comments, write in. I'll be delighted to answer your questions, your concerns, help you with your clients. If you're looking to increase your knowledge and learn all about how you can become really expert at dealing with client injuries and pain conditions, helping to prevent problems, check out our essential crash course for personal trainers on injuries and pain conditions at the PostureSize.com website. I hope this video on multifidus function helps you with your clients with chronic lower back disc pain.